let's talk a bit about women's health issues in particular. And you mentioned breast cancer, but what are some other health issues that you help patients with using a whole food plant-based diet?
So interestingly, a whole food plant-based diet, also one that's lower in fat again, and this is even some of those healthier fats like nuts and seeds. We usually ask people to limit those to about a handful a day because they do have some good nutrients, but the fat content can cause a little trouble because plant-based diets, low-fat plant-based diets can be really effective for women's health conditions that are linked to excess estrogen in particular. And there are a couple of reasons for that. One, these diets do just, eating this way, I hate to say diet, it's just a life, it's just the way you live, It promotes a healthy weight, and body fat itself actually can produce estrogen. So right there, estrogen levels are going to start coming down to a healthier level. Saturated fat in particular is linked to increased production of estrogen, and fiber in the diet, this is where we're going to come back to what you were talking about, actually is linked to lower healthier estrogen levels. And that's for a couple of reasons. One, soluble fiber. So that's fiber that gives food sort of like a creamy texture. So there's a lot of it in oatmeal. There's a lot of it in barley. It actually acts like a sponge, and it soaks up excess cholesterol in the gastrointestinal tract. So in the intestines, when our body wants to get rid of extra cholesterol, it puts it into bile and secretes it into the gastrointestinal tract. If soluble fiber is there, it will soak up some of that extra cholesterol. Why am I talking about cholesterol with estrogen? Because they look the same molecularly. They're very similar. And the body will also secrete excess estrogen into the GI tract. And so if you have soluble fiber there, it soaks it up and holds it in place. And then that insoluble fiber acts like a scrub brush and helps keep things nice and regular and moves things along so that it exits the body as opposed to being reabsorbed in the gastrointestinal tract. So some of those things, breast pain, it can help with breast pain. Another big one that we have pretty good data on is cramps. So like menstrual cramps. We did actually did a study here, low-fat vegan diet, and it was associated with significant decrease in the intensity of pain and how long it lasted. So I definitely, have myself had some past history with that and know people who are just, they're just laid up at home with cramps on the first day of their cycle. This kind of diet can be incredibly helpful for that as well. Another one that I think a lot of women, an increasing number of women are suffering from, is PCOS, or Polycystic Ovary Syndrome. It's tied in with insulin resistance and actually an overproduction of androgens, or male hormones. And about half of these women who suffer from this are obese. And so a whole food plant-based diet does a couple of things. It improves insulin resistance. We talked about that. So it helps the body's insulin work better. And it promotes weight loss. And in this condition, even losing just 5 or 10% of body weight can help people regain a normal menstrual cycle, which often is a key sign of PCOS. So it helps with that as well. And healthy body weight's also linked to improved fertility. So these are a lot of things that women are struggling with that get better. And this is anecdotal from the clinic. Some people have had improvements in sort of these menopausal symptoms, so hot flashes, but I don't know of any actual studies on that. Those are just things that people have told me. So I can't back that one up, but I've heard it.
Yes. And I think some of the other things that are of concern to women are like endometriosis and like a prolapsed uterus, or and like you were saying, fertility and having a healthy pregnancy. And how does a whole food plant-based diet tie into those?
So in terms of endometriosis, I'm not as familiar with that one, but I would certainly imagine that since that's, a growth of the sort of uterine tissue outside the uterus, getting less of an estrogen stimulation would improve the symptoms of that for sure. So that seems, again, I don't know the studies on that specifically, but very likely to be helpful with that condition. In terms, again, like we mentioned, for fertility, that's going to be a useful thing. There's one other piece. What was the other piece?
Healthy pregnancy.
Oh, so yes, healthy pregnancy. So actually, women who are on a vegetarian or vegan diet have similar outcomes in terms of overall like health of the baby, but there are some significant benefits. So we're talking about study finding a lower risk of excess gestational weight gain. So that extra weight, you know, you're supposed to gain weight with a baby, but it's gaining more than you're supposed to gain, and then having to try and take that back off afterwards. Another study found that if mom was eating a diet really high in plant foods, she was at reduced risk for complications. Some of those can be things like preeclampsia. So there really are it's not just that it's okay to be pregnant and eating plant-based. It could very well be beneficial. But again, women eating plant-based during pregnancy have some of the same concerns that, you know, other women do. They need to make sure that they're taking a prenatal. That's just sort of a, you know, across the board thing that everyone should be doing, that needs to make sure that it has vitamin B12 in it. The one piece that women who are looking at pregnancy in particular need to look at if you're on a purely plant-based, you know, vegan diet, would be to make sure that they have a regular source of iodine in their diet. So that's just it. It's in most people's diets right now. It used to come from iodized salt. So our grandmas used, everyone had the little, you know, the Morton girl. I don't know, maybe it's different brands in Canada, but, you know, they had iodized salt, and that was just what everyone did. And then it is no longer cool or hip to use iodized salt. We like Himalayan sea salt, or, you know, fancy sea salts that don't have that iodine added. The other place most people are getting it in their diet right now is, well, they're not getting it from there. They're actually getting it from dairy products.
Right.
But not because it's inherently in dairy products. So there are two places. They'll either add it to the animal's feed, but more commonly it's found in the disinfectant that they use to clean the cow's udders, and then trace amounts of it get into milk, and we only need trace amounts. So for women who are of reproductive age, I just recommend to switch to iodized salt. They're also going to have iodine in their prenatal, or to eat a little bit, you know, and just for general, for anyone to eat sea vegetables once or twice a week, but not too much, because those can be really high in iodine. So just a word about that. But on the whole, it's an incredibly healthy way to eat during pregnancy.
And I think the other thing that I mentioned was a prolapsed uterus, and I know they advertise like doing Kegels and strengthening your abdomen muscles, but there is a link to constipation, I think, for having conditions like prolapsed uterus and bladder and rectum.
Really? Okay, so that I was not aware of, but it makes perfect sense that that would be connected. So yeah, and again, for constipation, I mean, eating a diet that's rich in fiber and high in volume, and the other thing that plant foods have a lot of is water. And so sometimes people, they get constipated, they'll take a fiber supplement, they won't drink any extra water, and that can actually make matters worse.
Right. Yeah. Yeah.
So getting it in that whole plant food keeps things nice and soft and movable. So yeah, that makes perfect sense that that would be linked to prolapsed uterus if people are straining a lot. And if you're on a plant-based diet, that's not a thing you're likely to have to worry about.
Right. Yeah. And so we were talking about pregnancy, and that leads